So here's a big word: vulvovaginal atrophy. It affects about 50% of women with menopause. Not everyone gets it, and there's different varying degrees of it. But what it is, it's the drying and thinning of the vaginal tissue. And how do you know whether you have this? There are some really common symptoms. So the first one is that the tissues just feel drier. They can also be more sensitive to touch, so you can start having pain with intercourse, or if you've had some tightness before but now it's quite painful, that may be a sign too. You can also start getting a little blood when you have intercourse, so the tissues may actually tear a bit and you get some bleeding. Another really common one is that you start having urgency, so urinary urgency. You feel like you have to go all the time. Or you actually may start leaking a little bit because the tissues are irritated and your bladder muscle is contracting and your pelvic floor is not closing as well as it did before. Another really common one is repeated urinary tract infections. So they call them also bladder infections. And many women with menopause think, I keep on getting these urinary tract infections. The first line of defense is actually vaginal estrogen. So using a cream that you can put into the vagina, or using a pessary or an E-string, or like a little ring that slowly dispenses estrogen back into those tissues. Because why it happens is we start to lose our estrogen. So this could actually happen even in perimenopause. So when you go to your doctor and you start having some of these complaints, it's burning now, or itching, or it feels dry, or it feels painful. I'm getting more urgency. I'm starting to leak. I have pain with sex. This could be because your estrogen is dropping during perimenopause. What's perimenopause? It's the time around menopause. So peri being around. So it's not just at menopause. It can be just after menopause. It can be before perimenopause. So oftentimes we think it just happens after we stop having our period, but actually it can happen even before then too. So if you do have any of these symptoms, that's how you can start thinking, maybe I'm actually losing the estrogen and my tissues are becoming more fragile. Go speak with your doctor and see what they can help you out with.